I'm Dr. Douglas Virostko. I've been practicing in Coshocton as a family doctor since 1993. What I want to talk about is what I think is the most important part of our job, which is preventive medicine. You know, we hear a lot in America about the so-called healthcare system, but really what we have is a disease care system where we take care of people after they're sick, and we spend lots of time and money and effort on this when these things could have been prevented. I look at our colleagues like cardiologists and surgeons and oncologists. I look at them as firemen. They're coming to put out a fire. But it's much better to keep the house from catching on fire in the first place. And I think that's what our job in the primary care family medicine department is. Prevention is across the whole life cycle. We're ready to pick up the job as soon as the babies are born. Kids need to get vaccinations. I feel very strongly that vaccinations are probably the greatest advance in public health, with the exception of clean water and safe sewerage. Shots aren't just for kids. I mean, there's all the ones, measles and such, that you get as a small kid. And then as you get older, into the teen years, you get things like meningitis and HPV vaccination. Then as an adult, every 10 years, you're supposed to get a tetanus booster, which also contains the whooping cough vaccine. Whooping cough, for adults, generally is not a bad disease. So many times we've had somebody, I had this cough that just hung on for the longest time, and that may have been whooping cough that wasn't diagnosed. Problem is, then you can transmit that to a baby and it can be life-threatening. Men will take immaculate care of their tractor or their motorcycle or their truck, but they won't even come in for an oil change for themselves. 1/3 of the time, the first sign of heart disease is just dropping dead, and there's so much we can do to prevent that. They need to come in and do some preventive maintenance on themselves. We're not that scary. I just want to stress the importance of having a primary care provider, a family doctor, somebody you have a long-term relationship with, who understands you, who you can work with to prevent problems and not just wait until people have a severe illness.